Hello, I am Nicole Allyson from N3A. Allow me to introduce POTS to you. Here's what you need to know about Postural Orthostatic Tachycardia syndrome. So the first question that might come to your mind upon opening this video is, what is POTS? Is that even a real condition? Well, apparently it is. It is actually a form of dysautonomia, which is a disorder of the autonomic nervous system. For your information, this branch of the nervous system regulates functions we don't consciously control, such as our heart rate, blood pressure, sweating, and body temperature. To further understand POTS, it is a condition characterized by too little blood returning to the heart when moving from a lying down to a standing up position. So usually when a person stands, the nerves of the autonomic nervous system tell the blood vessels in the lower body to constrict. The vessels then work against gravity to keep blood from collecting in the legs. This automatic response makes sure that the brain has enough blood flow, and if there is not enough, a person may feel lightheaded. This is what happens with POTS. Since the ANS doesn't work in its usual way, the blood vessels doesn't constrict enough to make sure that there is enough blood flow to the brain. To compensate for this, the ANS makes the heart beat a lot faster instead. With POTS, signs and symptoms may appear suddenly or begin gradually. These may include dizziness or lightheadedness associated with orthostatic intolerance, which often results to fainting, and may be frequent for patients with severe POTS. Patients also complain of memory and concentration problems, tachycardia or fast irregular heart rate, accompanied with shaking and sweating, fatigue, chest pain and shortness of breath, poor sleep, or insomnia. POTS is an unusual life-altering condition. It is also considered a rare disorder. But the question is, how rare is POTS? Well, according to Dysautonomia International, it is estimated to affect 1 out of 100 teenagers, and if including adults, a total of 1 million to 3 million Americans. POTS is most frequently seen in young women, often less than 35 years of age and below. The long-term outlook for POTS is generally good. Most symptoms come and go throughout the years following its diagnosis. With appropriate treatment and lifestyle modifications, most patients have seen improvement and returned to their normal functional state. But what exactly causes POTS? Until now, the general cause of this condition is not yet determined. However, different studies suggest that the following may contribute in acquiring POTS. Viral or bacterial illnesses, trauma, specifically physical trauma, and in women during or after their pregnancy. Last but not the least, underlying conditions such as diabetes, lupus, or cancer. However, take note, studies are still ongoing to better understand the origin of the condition. One of the frequently asked questions about this condition is if there's a cure for this. Unfortunately, to this day, the cure for POTS is yet to be found. But worry not, because there are a lot of treatments and medical management available, including medications which may vary depending for each patient, compression stockings, changes in diet which patients are usually advised to take more salt and water, lifestyle changes and exercises which are, of course, POTS friendly, improving sleeping time, and support groups which may include cognitive behavioral therapy sessions. Thank you so much for watching the video, and I hope you had fun learning with me. And also, I'm asking for a favor, please hit that like and share button so that you can help me raise awareness for POTS and for the grades as well. Thank you. I hope to see you in the next Genius Hour.